Okay, so this is the digital caliper that we're going to use. There's a battery in this little compartment here. You turn the battery on, and you'll see a number appear. I don't know why it's flashing, but okay. So what you want to do is you want to zero it. Put it to the closed position, like such. Then you want to press the 0 button, and it goes to 0. And then you make the measurement of the ulcer, and that's 3.01 millimeters. Okay? And then what you do is you write down the number, and you put it back to 0. Make sure it says 0, zero it again, and then you open it up to what you want and make your measurement and record that. And you can switch between millimeters and inches. Okay? So that's millimeters. Okay? Good. So that's, we'll come back to that. Turn it off for a sec.
So the white's always zeroing?
The 0 is this little yellow thing here, okay?
Oh, sorry, yellow.
Okay, so this is millimeter. You want to measure these in millimeters, and this is on and off. Keep them off if you're not using them, okay? Has multiple little lesions. We're not talking about anything over the knuckles, right?
Over the MCP.
Over the MCP, sorry.
But
Okay.
PIP, yes.
Okay. So let's ask the questions that we were going to ask. Is this an ulcer?
No.
Anyone think that's an ulcer? This lesion here.
This?
No.
No, not really demarcated. Can't see the base, eh? Okay, it's hard to. These hands are hard to. Is this lesion an ulcer? This long, crusty thing.
Are you asking, was it ever an ulcer?
He's coming in today. You want to know
Not
if
an
put him in
active
study?
ulcer?
Would you measure it today if you were
No.
starting in the study?
No.
No,
You
right?
wouldn't call that an ulcer to put into the study. Okay.
But if
Would
it were
measure
the
But I
end
would
of
call
the
this
study.
an
At
ulcer.
the end of the study.
Okay. What about this? Is this an ulcer?
Yes.
Yes.
Let's see.
You see? Okay. Fine. Is this an active ulcer?
Well, this is an ulcer, whether it's an active or not.
Oh, I was
So would you
going
put him into?
indeterminate.
Would you call it an entry criteria ulcer?
Well,
for-
so if you look here,
Oh.
you see a little
Oh,
crater.
that'd be hard.
I wouldn't call it an active.
So this would be, but this is an ulcer?
Indeterminate.
Yes.
Ulcer.
It's an ulcer?
Indeterminate.
It's an ulcer that's indeterminate, okay? So
So
this
if
ulcer,
he was entered into the study, this would not be the primary reason he would be entered.
That's
but
right.
What you'd have to record.
it's
it
an ulcer
as
that
records.
developed during the study, or it's
Pre-existing.
partially healed, or quote, it's an ulcer that was active before and now is indeterminate,
Indeterminate.
okay? And you'd have to measure this ulcer, right? So we're gonna measure this with a caliper. So we're gonna turn on the calipers. 0, and I'm not sure why it flashes. Anyway. Okay, so what are we gonna use? Oh, this is one of those serpiginous ones, eh? So let's look at the long border. Would we go from here to here and say that
This is big.
that's the measurement approximately? Hold on. Do we all agree with that?
No.
Seven
No,
point-
No, I would
smaller.
say it's smaller, the little round thing.
I
Or
don't know.
smaller.
Well, wait, what are we measuring here? We're not measuring the little round thing. We're
indeterminate
measuring the
area.
whole
You have to do the
whole
indeterminate
indeterminate
ulcer.
area.
Okay, so even this thing.
We're
Because you don't know
measuring,
what's on.
we're measuring
Okay,
From
here.
here
Okay, to there.
to
Okay,
here,
good.
right?
Okay.
Okay? So we're going to put on the calipers from there to there. And then we're going to measure across, I would
Right,
say
you got a
probably
0
around there,
there.
right?
Do you have to re-zero?
Oh,
Yeah,
sorry,
we've
then I gotta put
re-zero,
up all
but
that,
yeah.
0, which it is, and measure that. Okay, we all agree?
Right, there's a sense in my mind, though, that indeterminates get oversized. That's my sense, just as an aside. Because active,
I think this one is.
this isn't active, but
No,
if
I
there's
know.
a thing in the middle
So what's
that was
that?
showing. See, I'm never really sure on indeterminate.
Press one down to
I've seen
0.
people
Where there, I guess,
recruit
from
ulcers
the
like
edge of
this.
skin to the edge of skin.
But these are not active ulcers. But you do see the crater in this.
Okay.
And that's where the 2 millimeter thing or
So that?
something becomes
Like,
important.
If you see how they go. What about,
this one?
which one?
You can't see that one? Is there anything there?
Is that an ulcer?
Ici, you know.
No,
Okay. This is not an ulcer.
no.
This is just some hemorrhage.
Okay, so
Okay. What about this lesion?
Huh.
Can we see?
Hello, oui.
So it's painful.
He says
You weren't
he
supposed
says
to-
it's an ulcer because he says it's painful.
This one here on the
It is
thumb.
Ooh. It looks like a fissure.
I don't think so. I think it's a serpiginous ulcer.
Going down like that.
Yeah, I would call that an
An
ulcer.
ulcer.
Okay.
And actually, I would
I
call
don't-
that an, yeah,
Let me see.
Would you call
because
active?
it is,
You would
Is it
have to
Greater,
call it an
yeah.
active
Yeah,
ulcer.
okay.
wouldn't
yeah.
So you know what?
What's the
There
job?
you'd have part of the group that would never even measure it, and part that's measuring it. Like that, it's pretty variable.
Well,
right?
we're
'Cause I
coming,
don't-
we're
I
trying to
wouldn't,
decide here.
Right, but that's what I mean. I don't know that I don't think I'd call that.
Well, let's come
So
to
then it's-
consensus.
But I
So
think
why, those who
your-
feel this is an ulcer, why
your-
is this an ulcer?
Your comment that he said it's painful probably swayed
Yes,
me.
yeah.
But I would call this as an
No,
ulcer because
there's
you see the
lots
crater.
of epithelialization and
You
there's
see the
depth.
crater.
And there's
Yeah,
depth.
Those are the
There's
two
depth.
there's the
criteria,
crater, yeah.
right?
So I think that, Janet, you would have to, following the rules, call this an ulcer.
But a fissure has a crater too.
It's hard to tell from here.
So-
that there's
Fissure has a
depth.
crater too.
But it's
But it doesn't
not
have loss
a
of
loss
epithelialization.
epithelialization. That's
Right.
right. You see some
Okay.
epithelium at the
Okay.
base.
Yeah.
And measuring this one, we have to stick to our rules, right?
Okay,
So we measure the longest diameter.
yeah, this is
And the
gonna,
longest axis would be like that.
okay.
And then we go back, we zero, so to zero, then we measure probably a very, very small distance across there. Would you agree? Okay. Did we look at this one already?
Yeah.
Okay, and look now? Okay. Okay. So, what about this?
Yes, that's it.
That's an
That's an
ulcer,
ulcer.
Indeterminate.
Indeterminate. 'cause we-
Indeterminate,
But
although
what
I
about
wonder
that-
there's-
See, I thought it
Where?
might be
Active.
active there at the top.
The top is
where
it?
it's
top.
red.
Show me what you
I'd
mean by
have
the
to look
top.
closer.
Okay, I wondered about right up in here.
Yeah.
I take my glasses off.
I gotta, yeah.
No, that's not an active ulcer.
I think it's indeterminate.
Is it painful?
Stop.
Okay.
I don't think that's
If it's not-
I don't think that's fully
No.
epithelialized,
Ça fait pas
but
mal.
yeah.
Non, c'est parce que je lis vos
In
réactions.
the
c'est pour ça.
surgery, I
Non.
would call that
Non.
active. If the patient
C'est sûr que si son il touche, ça fait mal.
Well,
So
from a
if
treatment,
you
in my
touch it,
clinic,
it
I
hurts,
would
he
treat
says.
it. But from a
Yeah,
clinical
we
trial,
treat
I
it.
wouldn't include
No,
in
no.
clinical trial.
Okay, so then we're gonna measure this one as an indeterminate across the here to here,
Yeah.
and then maybe here to here, which is
Or up
halfway.
higher.
But what did we
Up
say? Is
higher.
this an
See, that's
active
what
or
I
no?
wondered.
Indeterminate.
Indeterminate.
Indeterminate, okay, good.
Okay. And, sorry, you wanna show us where you would do the cross one measurement?
This,
Well, that's the long diameter.
Yeah.
and then here to that.
See, I'm
No.
going up there where you
know,
are
I
too.
would go
Put it
from
on.
here till here.
Yeah, I would have.
See, I went up higher, but I wonder actually, by the way, if there's calcinosis popping out under that.
No.
No, I don't think so.
No, I don't.
I can't tell. I'm seeing a shiny thing here from the slide.
Okay, so, so we're having trouble with what the shorter axis is, eh?
You said
I mean,
90 degrees.
Yeah.
9
perpendicular
degrees to
the
the
long
perpendicular
axis,
to
right?
that,
So
but-
then-
That's
And
where-
usually
That's-
toward the middle,
Yeah.
because that's where you measure the ellipse. And I have to admit that that is less than that, right?
Yes.
And you really want to measure kind of what that area would be, right?
Mhm.
So which one do we use? Maybe we should stick to the middle, as close to the
agree.
middle as
That's right.
possible.
Everybody
Okay.
follows that.
Well,
clo- as
it's
close-
not middle.
Or the larger.
It says no,
No.
it's 90 degrees perpendicular.
But I meant at the middle point
But do
more
you
or
mean the
less.
middle or the larger largest?
The middle part of the longest diameter, perpendicular to that. In other words, as if this was a perfect ellipse.
Oh.
Okay?
But if
Because
you
it's
make
a-
that
it's a
rule,
dumbbell shape, then
Right.
you'll end up with a
Probably a
narrow
more
right,
point.
right.
Or
Or if
cup
it's that
shape,
serpiginous
like this
thing,
one,
yeah.
you know.
Yeah, it's not easy.
But we just have to agree. Is it
I
in
think
the
we just
middle
have to
or it's
agree
in the
on
middle?
one concept. It could be the largest perpendicular, or it could be right near the middle.
One, yeah.
So what do people, if they actually measure or eyeball, what do you usually think?
Nobody measures them.
If it's
No,
the
they don't.
largest, it exaggerates.
And
If it's the middle,
you
it
can
can
may
either
miss.
under or
Underestimate.
overestimate it, but at least yeah, it would average out. If you do it in the middle, it's equally as likely to be larger
then
on
you
one
don't know
side
the
than
bias,
the other.
right.
So it's an unbiased, so the
So,
middle is
so
the
stick with
middle.
close to the middle. So the decision is close to the middle, so we would measure it probably from
But
here
for the outcome,
to here.
wouldn't it be
Yeah.
better to measure the largest
Okay.
and we think maybe it's gonna.
Okay.
By the way, we
You
call
see
that
this?
one indeterminate.
Yeah.
right?
Is this an ulcer?
Yeah, I mean,
Yes, that we,
that would measure more difference.
No.
yeah.
Well, is it an ulcer?
I'm sorry, which one are we looking at? I think yes. Crossed it over, but it looks deep in the middle. I'd call it an ulcer. You'd say no?
No, I'd say
It's,
yes, but I don't
yeah, I
know.
would say, I think it's an ulcer.
It's
An ulcer?
indeterminate to begin with, I don't know.
Most of us would say it's an ulcer.
It looks.
I can be persuaded to say it's an ulcer.
Indeterminate.
Indeterminate ulcer.
And you will measure only the little part in the middle, or?
No, indeterminate, we gotta do the whole
Whole thing.
thing again.
So probably, I mean, this stuff out here, I don't know is anything, but this in here looks like the area where, is that, you agree? This I don't think is, I think this is just dead skin out here.
Well,
I don't think this is
but
crust.
if you agree,
Measurement.
then
But you
then you have to
can't-
go from here to here and there to
Yeah,
there.
me too.
So you think this is
This
part of the
this is
crust?
cap.
Yeah.
It's crust, you
Well,
can't
I
say
mean-
if there's.
Just like peeling skin.
I mean, this is crust?
No, stop,
This is
stop.
different, right?
Well, I don't know, I mean, this here looks, okay, so if this is crust, you have to measure from there to there and there to there.
Yeah.
But you
Okay.
know, well,
Okay.
yeah,
Okay,
I
that's
guess
good.
so, okay.
What about this?
Okay.
To measure, I don't know.
Is this an ulcer?
This an ulcer?
Two?
Yep.
2 ulcers. One.
No, 2? Oh,
Well,
gosh.
today.
Today?
Today. We haven't seen it,
Today?
we don't know.
Started,
What,
No.
Yeah.
okay, what,
I
let's
call
talk
it
about
one.
this little area here.
Well, wait, is this a determinate or active?
Well, first of all, is this an ulcer, this
Yeah.
little area?
Yes.
Okay. What about, I think there's a de-epithelialization right there.
Can I see?
Yeah. I mean, from a strict definition,
Right there.
that's an active ulcer.
Yeah. So you'd measure the whole area,
What
though,
we
including
define.
the scar. So along here and across about there.
But you're
Okay.
you're breaking down the thing that was obviously 1, you're breaking it
before.
down to 2?
But now, this is his first visit. This is his first visit.
Can you show me what is active in here?
It's a little
See, I don't know if that's a
right
1
around there.
versus a 2.
Okay, yes, I
because
see.
it's
active area is that little tiny red spot in there.
Oh, boy.
if we call it
Well,
active,
but you know, that should be defined. We didn't give a millimeter.
if I
No.
do,
Did somebody say this is active?
an
Sorry.
indeterminate,
Well, it
Okay.
is active. It
And,
makes active.
and what about this?
a hole.
Oh, so that?
Yeah.
Because I don't want
If we
it
had
to
a size
then-
criteria, though, that might not make it.
Yeah.
What's this?
Can I say?
I don't think you can.
I don't think you can say there's depth.
Well,
No.
I would say that's a ulcer and it's an indeterminate ulcer. That's what I would call it.
Yeah. But you think these are active?
See, I
This is
have the whole
active
thing as
because of that.
indeterminate, and I would call it that for length, and then the middle, the perpendicular middle is width. Because
As
to me,
one?
that's 1, well, when you sort of draw around it, I think it started
It
as
was
1,
one, yes.
and he's got 2 areas of scabs, and I don't want to call a 1 a 2, because that's, so that's what I would clinically say, is I think this is 1 that is
inactive.
partially healed or indeterminate.
Yeah, I couldn't call it.
So,
No, but you
But I
would call
think
it
if it
an
came in the
ulcer.
first time today,
Yes.
though.
Yeah.
Yes,
You would
but
have
it's
to
call it
not
two.
showing
You
it
would
one
have
ulcer,
to- you would have to
you're
call
calling
it
it
two.
2 then, when you do the,
so this one,
way.
yeah,
No,
this is active.
I'm calling active ulcer an indeterminate ulcer.
Yeah, indeterminate. Okay.
That's what I'm saying.
I'm saying overall indeterminate, and I do a longer length, so we're gonna have
Ah.
huge variability. I can't help it, because I think the way the
Ulcer,
skin peels out.
We looked at that one, no?
We did that one.
Because they
Okay,
do
we
heal
did that
like
one.
What
that.
about this
They
one?
heal
Do you
in
have any-
partial.
Okay,
Yeah.
what about,
And I don't wanna
what about
break up
this
an
one
ulcer.
here?
Healed.
Healed?
I don't know, I can't say I'm at. Oh, no.
Indeterminate.
Gee,
I mean,
that would
anytime
be-
there's a scab,
Yeah.
it's indeterminate by definition.
I'm not sure what's a healer.
Unless
all-
you see active epithelial,
Well, we did-
then it's still active.
Yeah, we saw that here, right?
Yeah, yeah, we
That's
saw
what
that
we saw.
before.
Acho que ela
Yeah.
é certinha.
And this,
Yes, ulcer.
ulcer,
Ulcer indeterminate.
indeterminate. Measure, probably measure across the long
Yeah,
axis there and
yeah,
across around
yeah.
there, eh?
So do we have
Okay.
That's the
Yeah.
problem.
Yeah.
From a
Ça, c'est pas la
ulcer
même-
is the
la même
ulcer
place.
here, and that's why we stick
Yeah.
there.
So do you have any
Some studies,
active
by the way,
ulcers?
want
Yeah,
to even
there
though
are
there
two
are
active.
others,
Two.
Well,
we don't have to
there was
worry about that.
one here.
This one we
And
some
thought
studies
maybe.
record it.
I mean, obviously there's disagreement about this.
That's
A
not
little
very
pink
Well,
spot.
but you know,
Depends on if there was a
and
size
then
criteria.
and then there
Is
was
there
here.
a heel ulcer there?
Things
Or
get
not?
This one.
go there.
That one has
we
that
just
indeterminate.
made
I mean, I wouldn't include that in clinical trials, but you know, that's how we define it right now.
If we required active ulcers at the base of the trial.
And the other
Well, then
problem,
it'll meet
Plus
the
most of-
criteria.
plus
So
most-
Oh, for one,
a
he's
one
one
became a
ulcer.
two.
that's a problem.
They're
And the other
not, they're
problem
not
is,
dorsum, they're not tips.
Well, it depends on the trial.
Depends on the
Yeah, that's
Well,
okay.
that would be an inclusion criteria aspect of the trial.
So size and
Okay,
location would matter
thank you,
whether
merci
he'd be able to
beaucoup.
be.
These ulcers, that's why he came, why these lesions, that's why he came to see me, all right? So, is this an ulcer?
No.
Healed.
Pit.
It's a pit or it's a healed thing. It's not an
They're
ulcer.
frequently tender, so.
Mhm.
Between pit and then the heel, it's gonna be hard.
Right, but
Doesn't
it's
matter.
not, I
Yeah,
wouldn't
from a
measure
clinical
doesn't
that.
trial
matter.
purpose, this is
So
not
why are
ulcer.
we not defining this
I
as an
can't see
ulcer?
it, but if it's a pit, it means it's
It's not
epithelialized.
deepithelial.
Is it throughout?
Yeah.
Oh, there's,
I
I,
don't think
to
there's
me,
an
there's,
open area.
I don't think it's a little
and they
area
can
like
still
that.
be sore. No, I wouldn't call it.
Okay,
And I would say lots of
and these
things
also
that had
bother him.
occurred.
They're not
That
ulcers.
bothers him, it's not an ulcer?
No.
The tips of your fingers bother you, eh?
Yeah.
And these
they
are a little
probably-
bit of a pit here,
Yeah,
maybe?
right.
Okay, and this is not even a pit really.
That's a fissure or just
Okay, and
dry
then,
skin.
and then turn for a sec.
Okay, so the only one that I questioned was this one.
Ulcer.
I
No,
thought
but I
maybe
don't.
I could see a bit of de-epithelial. It was very cratery looking.
Yeah, it is, it is.
Could be craters, but craters aren't.
But you know, I don't see any de-epithelialization. I
The
see,
definition of a digital pit or, you
yeah.
know.
Did you do an
Okay.
X-ray of his hand? Maybe he has calcinosis on it.
so Marty, that's a good example where
Yes.
Yes.
there is a little bit of crater,
Yes.
but there's no de-epithelialization.
Okay.
Yeah, exactly.
So it's
what
right
a pit-
that's
because
what a pit
something's
is.
happening
That's right.
underneath the
That's right.
surface.
Something
Deeper,
has-
deeper.
that's right. Or has
prior.
So we will not count this even though it bothers him in his little, okay, so that's important. So this would be called a pit, not an ulcer. Okay, that's good. So let's start here.
Yeah, I'm not.
Is this an ulcer?
No,
No.
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 Why not? Can't
that's a
see.
fissure. I don't
This
think
is a
that's an
fissure,
ulcer.
no.
I don't say
Well,
it's a
I can't
fissure,
see
but
very,
it's
it's
not
not an
loss
ulcer.
of epithelialization.
It's not through and through. This
Healed
here?
or no?
No,
No.
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 Okay.
Now what about here? This thing.
Oh.
We're gonna get there in a second.
See, that's
Let's
a,
see that. Let's see how
Sorry.
we can show that. Okay, fine. Okay, how about like that?
Yeah.
Can you see that, Felipe? Around here?
no, that's an ulcer and an active ulcer, how we defined it.
It's in the.
This is an active ulcer
Well, no, I'm saying it is, because that's how we define it.
because there's epithelialization
Epithelialization and depth.
and some depth, right? Okay.
Yes.
Would you agree with that?
Yeah, okay.
And a little ulcer, but it's an ulcer.
There's a hole
I
in
can't tell
there.
the
And to-
difference between
And
indeterminate
to measure this, we would measure from either from here or from here. Which one?
Right, are we measuring the bigger or just the
The
little
bigger
hole?
part.
You have
You
to
will
measure the
have
bigger
to
part.
This
You have
looks
to
like
measure the
this
bigger
looks like
part, right?
skin here to me.
See, I don't know if it's indeterminate.
But do
I have
everybody
to-
agree that's active, the way we defined it?
Janet needs to see.
I probably need to
I
see
can't,
that.
right, I was gonna say.
Sorry that I'm being a bit unladylike here.
Go ahead.
Oh, I have seen, you know, when I've been to different sites, that people recruit such patients for clinical trials. Because it's quote
It's
unquote active
closer
ulcer
to
now.
active
Yeah, it looks
than
like
some
an
of the
active,
others, but
yes.
it's still.
So
Do you still call it indeterminate?
No, I call it active.
Active, right?
So we feel it's an active ulcer. Okay, everyone agrees it's an active ulcer. It's pretty small, but to measure it, pretty tough actually, eh? You'd measure from, probably from here to here.
Yeah.
And then across
So the
this way,
biggest
eh?
part?
Okay.
Yeah.
That we looked at.
2 patients ago, we saw the same thing and everybody said it was indeterminate. I mean, it looked.
Okay.
Right, that's to me, I
exactly
would
the
think
same
it might
to
be
me.
indeterminate.
And it was
I'm
just
trying
this
not to be a
pinpoint
naysayer, but I'm just not.
But you will anyway.
I,
So
no,
it's
but I'm
about-
just saying that, it's a bit
Because
difficult,
that's
isn't it?
So
Because
I think we've agreed to
I
the
wouldn't
rules.
roll that in.
But
I
it's
wouldn't
just
roll
as
that
there's
as an
Amanda-
active.
Subjective.
What?
It's still, part of it was a size criteria. We said that was too
Right, I
small
know,
to
too
be.
small, so like, how do you define that? How
Well,
big?
let's-
It's really
Trial would
hard to
have to
tell
tell.
whether it's just base of the finger that's de-epithelialized or there's a scab on it.
But you can't tell whether it's healed underneath that. It's very hard.
Okay, so which one?
So
are you looking
Ginny,
at?
you're saying it could have
This
been
one.
indeterminate?
This here?
'Cause
Yeah.
I think it's,
you know,
So
I
what's
think I'd
this?
actually call it.
What's this?
This is not an ulcer.
No, no, I wouldn't
No,
call
I
it.
don't think it's enough to call it an ulcer.
This? I would say it's an ulcer, but wait.
Why?
Why would you say it's an ulcer?
Okay, maybe not.
Okay.
It's superficial flaking.
Yeah.
Superficial
Yeah.
flaking, okay. What's this?
Huh. It's not an ulcer.
Maybe it's a heel.
Not, but for today, I wouldn't measure it.
No, actually that's a good point.
It's probably a
Is it an ulcer with?
Well, it's not a measurable, which means it's
If you
healed.
were
Whatever it is,
enrolling
it's not
today,
active.
you wouldn't measure it.
No.
But if it had been there
Then
as
I-
part
but
of the
I would still
trial,
say
you would
healed.
still
If
say
I
it's
asked you
healed.
today,
I
what
would
is it?
say- It's
If I
a
asked you today,
healed
what is
ulcer.
it? You say it's a healed ulcer?
But I'd say
Good.
healed, that's why I don't think I can measure there.
Okay, that's hard to see. Oh, what's this little guy here?
Tricky.
Okay. What's this little tiny dot over here?
Not an ulcer.
A dot.
A dot. So dots, little dots. That's important. So,
Little flaky
I mean,
skin
could be a
dots.
teeny little ulcer under there, right?
Yes.
But it's too
Well,
small
we
to
said
really.
that
Small
off-
to
off
Okay,
the-
we're not going
I
to count
can't
little
call it.
dots. Okay. And do we look at this? These here?
That's a pitting scar.
Pinning scars, not ulcers. Okay. Let's see your other hand. Oh, okay.
Oh, this is a very good one. This one.
Yes.
Okay, good.
Yes,
what's this?
and
It is-
indeterminate.
It's
Definite
correct.
ulcer, indeterminate, long axis here,
Yeah,
short axis
yeah.
here.
But I think we'd all be disappointed that we couldn't put her in the study. for
Right.
this
Because
ulcer.
this
Because
one-
we
Well, you know
all
what I'd
think
say?
that this is active.
I'd say
right?
go shovel the
Right.
snow and come back.
And we think that she could benefit by treatment.
Yeah.
Yes.
Yes.
And this one here is
Which one?
We had a patient
This
in
here?
Rapids.
we usually say in the summer.
Okay, what about,
She sat there in a clinic.
told us to take
Well, that's what Marco says he does. He sends everybody to the surgeon and they
Yeah.
That's what
No,
Marco
but
says he
he's
does.
providing them for healing, not to enter in a study.
right.
Oh,
But then he
well,
said he
then he
would
would bring them back though. He said he'd bring them back and put them in the
He
study.
does that, I'm sure he does that. Okay, this lesion here,
Well, maybe we should do that too.
No, healed.
What did he say?
No.
I see
But
what
I-
you mean, Marie, but I
agree
don't
with you,
know,
Laura.
I probably would have called that
This
one
is a patient
healed.
that we, all of us
Heart
believe
of
that
hearts
there's an
would wanna
active
put in the
ulcer
study.
underneath it.
Right,
Yeah,
right.
heart
Well,
of
we also believe that there's could be modulation of disease if the treatment worked,
what about this little,
because there's been lots of things.
this little tiny area here?
No.
Nothing.
What is it,
No.
nothing?
Nothing.
No.
And you
these
can
are all
see that
superficial
area
stuff.
too, Marie, that area
Okay,
there.
what's this?
These are all just scars.
Oh, this,
Well, that
Maybe
could
would
be an
be
indeterminate.
indeterminate, right?
Yep, sorry that we're bending your hand all over, but I think it's indeterminate.
That's one of the reasons that
Trying to help.
vessels are not included, because there's a lot of trauma.
Yeah.
And you can see how difficult it is
So
to
this is the
determine here
only one
versus
that's
a pump.
really.
Right, but we wouldn't
What about
say
the-
based
yeah.
on what we
it
said that
painful?
it's active. Yes.
Yeah, I mean. So that was the criteria that was used in treprostinil study, where exactly those ulcers were allowed in. But I think we need to be purist and need to exclude them.
Well, I think that it depends on
on
the
the
inclusion
trial.
criteria and stuff, but that to me is an indeterminate, that one. Because
Well,
I
let's
don't
Decide if you were
know.
designing a trial, if you would want to have an indeterminate new painful
Well, you
ulcer.
might
be
say
in the
indeterminate
study.
within X month or X weeks.
I mean, I think we all agree.
Within 4
Within
weeks,
four
We all
weeks,
agree
yeah.
indeterminate and
that that
painful.
ulcer, we're all saying indeterminate because we're following our rules.
But
We all agree that, for example, if you weren't in
This
the
is a
trial
skin.
and she
I
said,
would
this is
treat it,
bothering me, we would treat it as an ulcer. Active
Yes.
ulcer. We would give her
Absolutely.
vasodilators, with aspirin, whatever you want to
Yeah.
give her, right? That's a problem.
But you know,
That is a
if,
problem.
It's a problem both ways.
And think about it, all these patients that we've seen today so far, we haven't seen, maybe saw maybe one active ulcer or two based on teeny little areas.
yeah.
Active ulcers. Okay,
What we
so-
call one of our ulcers as active ulcers.
Yeah, one out of all these different ulcers.
Yeah.
We're not calling it an
No
ulcer,
ulcer.
it's too heaped up. Okay, that's a good point.
But it was something at some point, but I don't know what it is today.
This
What
is
is, what is this here?
Where's the other one? I can't see it.
calcinosis.
That's healed, whatever.
Whatever that is not an ulcer.
This is a good
This.
one on the thumb now.
Okay, what's this? What would we do with this? She comes in, she says, this is my problem, I want to be in your study.
Well, she wouldn't get in the
Not
Should be
study.
an active ulcer.
Okay,
Is that
Okay.
an ulcer?
is that an ulcer?
Well,
Is
first
that
of
an
all,
ulcer
there's
for the definition of a
calcinosis.
study?
How about the area
Yeah.
right up here? That
Okay, what,
Okay,
you don't
you're
think there's
wondering about the-
calcinosis under here?
I think there's.
I
Oh,
do.
and you can't tell though.
So I think this is one, I think we would all agree we would have to x-ray.
But there might be
Well,
calcinosis,
yeah.
but this may not be from calcinosis.
Right.
Well,
You'd have to
it
feel if
may,
there's calcium
but it
there.
may. May not, but it may,
Yeah.
right?
Right, but
But it's
there's,
not-
Isn't it the
right.
same
I think
pump
if
that you
there's
showed us?
underlying calcium,
Ah,
then you
okay.
I don't
can't,
think so.
you can't
So
include
it
it.
looks the same.
So would you say not applicable, or would you say calcinosis and indeterminate and
Well,
measure it?
Well,
Depending on the definition,
I
no,
would
but.
x-ray, I
So
would x-ray
assuming there was
this.
calcium there.
Let's say there's calcium.
Well, there
right?
is, there
Yeah, let's
is.
say there's calcium in the thumb pad.
Yeah.
Right, there is.
And then
calcium
I
in
think
the
you
pad.
can't say if it's from ischemia or from calcium.
That's
You
right.
couldn't
And I
include
think
it.
in
So
that,
this
in
would be
that
no
case,
ulcer.
the safest way to treat this is no
No
ulcer.
ulcer.
Agree? Are we all, can we agree?
And if
But
there's
you're
no,
thinking
and if
that
there's
maybe
no
the one on the
calcium,
part-
if there's no calcium on the x-ray,
Then it's an ulcer.
Right, but there is calcium.
It's an ulcer. Now, would you call it indeterminate? Because it's almost, well,
you're,
there's
you're
still a
looking at,
scab.
let's see what we're looking at first of
I
all.
think
We're
it's
looking at
scab.
this here, right?
Yeah.
Yes,
And Maureen, what were you saying? You think it's
I think it's scab, I don't.
I'll call it indeterminate ulcer.
indeterminate, and to measure this would be tough, because we've got this,
Triangle.
Yeah, so we do the longest
Maybe
axis,
two.
And
we
then-
said,
and then
then perpendicular to it,
this,
which
yeah.
is just a little
That
bit.
little thing in there.
Yeah, no, the
No, it would
middle,
be-
remember you said the middle
Yeah, the middle,
perpendicular. So the middle perpendicular is like almost nothing.
I think unless
This
you're
little
doing
thing here.
Yeah, like a
Okay.
point,
Okay, so we stick to the
yeah,
rules.
0.2
Okay. Is it,
centimeter.
one of this,
What about this
What
one?
about this?
No.
Dot.
No, this. A dot?
Activals.
Serious? No, he's not serious, people who are listening.
I
Okay.
almost wonder if today we should,
Too
for the
small.
ones that we think are
Okay.
calcinosis but don't know for sure, if we should actually do our measurement and then just write a little a check mark at the end. I think it's
Okay.
calcinosis or something, a little star, check mark.
Okay,
Well, we
hang
can
on,
mark
hang
it here,
on,
not
hang
an
on, 'cause
ulcer,
this is being recorded for other
calcinosis.
things.
What about
And
this
still
one?
measure it.
Which one?
Right, because
This
some
little
of
guy here? What about this?
because say if it was bigger a month ago, because that could happen.
I mean, that's a scab. I think so. Right?
Yeah.
I think there's a bit of little
mean,
This is
calcium
an
in it, just
indeterminate
like
ulcer?
there's calcium popping
No,
out there.
I don't
I
call
think
it an
it's,
ulcer.
I don't either.
Too
Well,
small.
but by
I mean, the
definition,
presence of a scab does not, I don't think we should use a presence of a scab as
No.
being an ulcer. I mean, you can have scabs and crusts on fingers.
have-
Yeah, which they often
everybody's
do.
saying it's too small, but we didn't define
No,
No.
that's right.
that. So
We
I'm not
didn't
sure
define.
why we are saying it's too
But you
small.
can have
But
a
I mean, the
superficial
presence of
crusted lesion.
Yeah.
You can have
The
a
question is
crusted
the
lesions
discernible
and a
depth
scab, yeah, you have
Under
to
it,
have
if
it.
it's over the top of the skin and
Yeah,
it's
you
crust, I
can't
don't
say-
think you can
can't
say there's
say it.
depth to
No.
it.
And also, if you
Well,
look
how
at the
can you
very
say
center of
this?
that, there's
Bit of a
a,
guess.
I
This
mean,
is not crust, I think
right
it's
now
a
there's depth.
I'm not, I was talking about the other one.
No. I'm just saying
no,
that.
just saying, that thing, I wouldn't have even thought to measure. Now that we're talking about it, I still would say I don't think I'm going to, because there's a bit of calcinosis peeking through, just like there
Well,
and
I'm
there.
not talking about calcinosis,
No.
but if this thing was bigger,
If that thing was bigger,
And then came in now?
no,
I would
bigger
call
and
it-
looked exactly the same.
It's an ulcer.
I think
I don't think
there's
I
no
call it
depth at all.
indeterminate.
There's
I
only,
call it
it's
yield.
heaped up, but like the other one, it's much smaller. Because there's no depth, we don't really know what it is. I think we can't call it this. Well,
Okay.
you said that, you have to, okay? In your heart you may
No,
think
but
it's
in
an
my
ulcer. In
head,
your heart you
I
may
say,
think it's an
what's
ulcer.
that? There's a little ulcer there. Whether there's calcium or not.
Well, I think the way we have defined an ulcer, and if size is not an important
Yes.
then that would be considered an ulcer.
But how do you know
No.
that that's got depth?
No,
if
there's-
it's-
how do you know that has depth?
I don't know what it is.
To me, it looks.
I mean, I don't know what that is.
Right.
So if we don't know,
It's kind
I
of
would
like
say I don't know.
calling
I don't know
a
what it is.
cat an animal.
But by your definition, don't know becomes indeterminate.
So I think the future study design should
No, but
include
it's an
a
ulcer,
different
not
item.
ulcer.
Right, I
That's
think
right,
it's
ulcer,
ulcer.
not ulcer.
Determinant.
Yeah.
Massive dental
I don't know
study
that's an
doesn't have
ulcer.
size
Right,
as
right,
a-
right.
Okay. I would say I don't know it's an ulcer. You can't be sure it's an ulcer, therefore it's not an ulcer. If you're not sure if it's an ulcer or not, never mind indeterminate. If you're not sure if it's an ulcer or not, it's not an ulcer.
Yeah.
That's what I'm saying, I don't think you should equate totally having crusting and scabbing as ulcers. I think you should make the definition.
Because we could nick our finger then and all have ulcers.
Right,
if
that's
we
what
don't
I'm
call
saying,
it
that's, you know, just because there's some crusting or scab, I don't think we should use that as a.